as you age, you tend to have more chances at benefit for doing some sort of growth hormone therapy. So the most common first start approach I think that people think of is growth hormone directly. And I was a huge fan and proponent of this when I was in clinical practice. I prescribed a lot of it. I took it myself. I thought it was fantastic stuff. The only caveat is I realized there's a very common side effect, and that is like you get the swelling on the hands and the feet, like the tingling, paresthesias kind of stuff, carpal tunnel. It's pretty common. It's like 30 to 50% of people.
That's the side effects for this stuff?
Yeah. Yeah. And so if you get that side effect on growth hormone, you typically discontinue the treatment. Usually have to wait a couple weeks, and then you can usually slowly start it at a much smaller of a dose and not have those effects. However, the issue is when you take growth hormone, it actually produces a super physiological spike of growth hormone. Because normally when you make it at night when you're sleeping, and it's this nice gradual curve over the entire night. But when you take it in an injection, all of a sudden you get this huge spike. And that's where you start to see all these side effects of like the fluid, edema, swelling, tingling, because you have this super physiological effect.